Good afternoon. I'd like to welcome everyone here to another Chamber ribbon cutting. I'm Trent Sanford, Chairman of the Board of the Gilmer County Chamber of Commerce, and today we have with us Andrew Williams from Home Instead Senior Care at Gilmer County. Andrew is the owner, and this company is new to Gilmer County, but they've been in business for a while in a couple of other communities, and they provide exactly what you would expect: assistance to folks that need help at their homes, and it may be adults, seniors, or it may be kids, whatever. He knows a lot more about it, obviously. We're going to let him talk a little bit, and then we'll let you ask any questions you may have. But we're glad to have you joining the Chamber of Commerce here in Gilmer County. We're over 550 members strong, and we support each other.
Yeah, that's
what
great.
it's all about. So,
well, I'm proud to say that we're a part of it now. We should have been a long time ago. We've been in business for roughly 8 years. In this whole entire, we cover the entire area up here, so we have a lot of employees. We've got about 80 employees total, so we're one of the larger providers. The services that we offer, kind of coupling what you were saying, you know, we do offer care for seniors and adults with disabilities wherever home is. So we're in assisted livings, we're in hospitals, nursing homes, it doesn't matter. We follow you wherever home is, wherever walk of life they're in. So adults with disabilities all the way up to seniors. So the things that we offer, anything from the bathing, toileting, grooming, dressing. We do meal preparation, the light housekeeping aspect, just running typical errands, the day-to-day things that would keep anyone in their environment safe. So we deal with a lot of cognitive impaired, dementia and Alzheimer's. That's one of the things that we really specialize in, is making sure that our caregivers are very well trained. We are very, very particular about who we bring on. So I think back in November we had a little over 120 apps, and we might have hired about 15. So we're very, very particular. So we do care about what we do. We're the only agency in the entire Northeast sector that guarantees their shifts. So if we say we're going to be somewhere, we're going to be there. Really important for our seniors for consistency. So I guess that's really about it.
Okay. Does anybody have any questions? I know I have one.
Sure.
I'm getting up in years myself, and my driving skills are not that good.
Yeah.
So if I needed somebody to take me to a doctor's appointment,
Sure.
Is that something that your staff can do and
Absolutely.
help us with? Or
Absolutely. We've even had caregivers that have gone on vacation, on cruises, taking their, meeting bucket list items that they never got a chance to do certain things they wanted to do, and now they need that a little bit of assistance, and we get creative. So yeah, absolutely. The smallest things, from just picking up prescriptions to taking them to doctor's appointments in Atlanta, wherever their specialist might be. So.
Andrew, if you'll allow me, he was telling me when we first got here about a college student that they actually went to college with, and helped this student make it through the 4 years of college. So that's just amazing to me that the service can be provided in that way. Does anybody else have any questions?
Is it limited to senior care? If you were, say, 35 or 40 living alone and you had surgery and you're kind of bound in your bed for 2 weeks, 3 weeks?
Absolutely. No, it's 18 and older. So that's the only limitation, is 18. But yeah, we've done that many times. So.
And I have a quick,
Go ahead, Gail.
I have a quick question too. I have a friend whose husband just had a stroke, and then on the heels of that, they discovered Alzheimer's. She's having a little trouble because they're by themselves.
Sure.
So is that something that you would do, like if she needed to go out?
Absolutely.
Provide.
So the one beautiful
thing.
thing about it, we're not bound by, I'm licensed with the state, but I'm not bound by contractual things. I don't do Medicaid and Source. Medicare, unfortunately, doesn't even recognize this industry, so we are private. So I have no contracts. They use us as much or as little as they want. Now, obviously, my #1 goal going into any setting is identifying what other supplemental needs can we bring in to minimize that out-of-pocket expense, because care can get expensive. So bringing in home health or hospice, whatever, we want to make sure that we're minimizing that out-of-pocket expense. So yeah, I mean, we will definitely be able to help out in any capacity, whether it's short-term or long-term. So we work hand in hand with home health companies, assisted livings like Cameron Hall. We're hopefully going to start partnering a little more with them, so their residents that may have a fall or something might occur and they come back and they're not 100% adequate to do things on their own, we can kind of supplement in as needed.
It sounds like it's going to be a great service for Gilmer County, a great addition to our community, and we're we're looking forward to having you with us.
Yeah.
At this time, we'll do a ribbon cutting if you're ready for that.
Yeah,
All right.
absolutely.
Thank you.